chats are popping up. Hey, we've got an incredible opportunity to talk right to the VA. Good friends of mine, Tim and Donnie. Just put your questions in the chat. We're going to have them go through some important highlights. So with that, Donnie, I'll turn it over to you, my friend.
Wasn't sure if you want to go by seniority and have Tim go first. It's up to
I
you.
was going to have you introduced.
Okay. That's fine. Okay. Well, my name's Donald. I'm a outreach specialist working with the on a gaming outreach community program headed by Tim Hudak, who's I'll let him speak on his own behalf, but after he's done, we'll start going with some information for you guys.
Yeah, we're just happy to be here and answer questions. Back to you, Donnie.
That was simpler than I thought. All right. So what I usually do is I usually go over a few things just for kind of benefits things that if you are enrolled in the VA to let you know that, hey, there is a lot of things going on with the VA that make access to care a little bit easier. For one, if you have a phone and you know how to use the apps on your phone, there's a VA app for healthcare and benefits. So if I didn't have my background blurred, I could actually show you. But if you look at mine and Tim's decal, you see that VA in there. That's actually what the app looks like in the App Store. So if you download it, what it'll do is it'll give you, well, you'll have to authenticate yourself. So you can't just download it and get your medical information without being authenticated. So you'll authenticate yourself. You'll be able to utilize the app with a thumbprint. And when you open up the app, it'll give you three options on the bottom. And one will be health, one will be benefits, and one will be payments. Within the health, what it does is it allows you to use secure messaging to communicate back and forth with your primary care, with specialty care, whatever teams that you're working with for your healthcare will be on there. I do warn people it is not for emergency usage. So if you have an emergency, obviously go to the hospital, get treated, because there is a 72 business hour window that they have to respond to whatever your question is. Or whatever you're, like for me, I've reached out personally and been like, hey, I blew out my shoulder. I need to get X, Y, or Z. And they triaged it, went through it, and I got what I needed during that time frame. Also, with the medical side, it lists your appointments in there. It should be giving you appointment notifications through the app. If you have medications that are prescribed, you can reorder your medications and have them mailed to you just through that phone app. And then on the benefits side of the house of it, within the benefits, you have access to your service connection percentage and what your service connections are. Any active claim that you have in there will also be listed within it. And then any historic claim as well should be able to get access from there. And then you have different any back and forth, any message or any mail that's come to you, whether it be your award letter, whether it be some type of Discord, something about like a claim or anything, should be listed in there as well. So you can look up older messages and review them. Also, you can pull up your award letter within this app and email it to yourself. And to a lot of veterans, that's highly important because there's a lot of benefits that are associated with it. So if you're like, oh man, I can't find
Donnie, I'll tell you, my favorite thing about the app is I get my migraines and I'm on some pain blockers for that. And I ran out and I just pulled my app up, sent my primary care a message, said, hey, I'm out. Can you refill this? And they said, yep, it's on the way. And I got it like 3 days later. So it's super awesome. If you're in VA and if you're not in VA and once you get in VA, definitely recommend downloading the VA Health and Benefits app. Always new features coming from it too. Sorry, I just wanted to boast about that feature because I use that all the time.
And what I'm going to do too is so last thing real quick, there's a payments thing where you can track your payments from the VA for your disabilities. I'm going to leave a link in your chat here, which will give you access to that app and then other VA apps that are associated with it. They have a lot of different things going on. So I'm just going to drop that right there. Hopefully the link will still, I don't think the link's going to stay to it. I'll get it in a second. What I want to do now though is talk about something that's kind of ease of care as well. And then after that, we'll open it up to all the questions. So with the VA, there is the website that VA's done something great is they've kind of streamlined all their websites to be va.gov. So that's the premise of all the websites you want to reach. va.gov, then you're gonna have the /. And for this site particular, it's find VA-locations. And what this does is it can find VA healthcare clinics, VA healthcare the medical centers. But then what I'm wanting to talk about is the urgent care, emergent care, and pharmacies. So urgent care, if you're enrolled in VA care and you have an urgent care need and you're not near a facility, you can go on this website, type in or do location, and you should be able to put zip code or whatnot, and it'll give you all the contracted urgent cares around that area. And then when you go to check in, say, hey, I'm a veteran enrolled in the VA healthcare. And then what they'll do is they'll take your information, they'll see you, they'll see what's going on. And let's say you do have medications that are, for whatever ailment it is, you can then go back on that same website and look up pharmacies, and there are contracted pharmacies in the area that will give you a 15-day supply for whatever they got you for that urgent care need. Now, if urgent care or pharmacy present you a bill that is not for you, that is for the VA gets sent the bill. And then if there is, for the most part, you have 3 times a year you can utilize this, depending on priority group. There's some other things associated with that. But for those first 3 times, there should be no bill presented to you, well, anytime, but the VA should always come from the bill should always come from the VA. And then lastly, emergent care. So if you have an emergency need and it has to be life or limb, I'm going to drop a telephone number in the box here as well for this. So what happens is, I'll use myself as an example. I had some chest pains about a 1.5 years ago, and I presented myself to emergency room, let them know I'm a VA patient. They triaged me. They got me through. They let me go. At the end of it, I called this number to say, hey, listen, I had an emergency issue. They said, hey, the hospital's already called us. We just need to verify some information. And then they verified my care, made sure it was an emergency, and they flipped the bill. So the VA is trying to make access a little easier, because we do understand that there are limited like if you live in an area like, we're all different. If you live in a rural area away from they know it's hard to get to these places. So when you have urgent needs or emergency needs, they're trying to make it easier to utilize these. So I will drop that number in the message box, and I'll turn it over to everybody else.
Yeah, I think go ahead, Lynn. Sorry. Oh, got it. Hey, we first had a question here, and again, drop your questions in the chat. We could talk for a long time and fill the space about what we like about VA, what we think you should consider with VA. Donnie and I are both users of VA, both health and benefits side, education side, home loan side, where we can vouch for a lot of this stuff because we've been through it. And we wouldn't be recommending any of this if we haven't been through it. And we know that there's some challenges in VA, especially the onboarding. There's a lot of paperwork in the beginning. There's a lot of proving who you are, and there's a lot of proving your eligibility, and that sucks. But once you get through that, it really is worth it. It's worth the squeeze to going through that. And there's a lot of people like Donnie and I know Lynn, and a lot of VSOs with the VFW, and just VA employees who are mostly over 40% veteran themselves, that are willing and able and really enthusiastic to help you get into VA. So with that, I wanted to jump over to, there was a question about home loans. I'm scrolling up about it after we were shooting the breeze a bit in the chat, but Joker, actually, if you could raise your hand, request to speak, and then Lynn or combat tested user, if you could elevate him, and maybe you want to just verbally tell us about your question, or we can read it if you don't want to. Yeah, no worries. I'm assuming you're Joker.
There we go.
Say it.
I was mispronouncing a few of them before.
It's Joker. It's Joker. My question is basically, I just recently got my rating after fighting for 18 years. And all of a sudden I'm getting hit with, you can get a home with close to nothing down with the VA. Some VA stuff just keeps coming across my email and stuff. And last I checked, I thought you had to have like a 600 to qualify for any VA anything.
Okay, so First of all, glad you finally got resolution on that claim. But there's a couple of things going on with that home loan. So the VA home loan is a guarantee. It's not necessarily the VA is giving you the money and giving the bank the money or giving the mortgage company the money. They are guaranteeing a loan. So if you have, if you're working through a financial institution, VA will come in and say, hey, if this veteran does not end up paying their mortgage and is at risk and foreclosure, we will cover that. And because of that, veterans get better rates because there's less risk for the bank because of the VA home loan guarantee. Where the rating really comes into play, because you don't need a rating to use the VA home loan. Any veteran can use the VA home loan, any eligible veteran. But where that comes into play, and I'm not a home loan expert, I'm just playing one on TV right now, I guess. So don't, Donnie will keep me honest here and others in the chat. But I believe if you are above 30%, have a disability rating above 30%, you don't pay a certain funding fee. So you actually pay even less than if a veteran without a service-connected disability rating lower than 30% for that funding fee through that. But VA home loan, for everybody who's wondering, it's a really great program. It does enable you essentially to have no money down in the process when you're negotiating with your real estate agent, or if you're doing it yourself and you're talking with the mortgage company. Essentially what they're saying is they're going to roll some of those fees and those closing costs into your overall mortgage. So that way you don't actually have to put money down and you don't actually have to pay those closing costs, especially if you're if there's a weird thing going on between the buyer-seller relationship. But it's a really great program. So, but that's back to, you mentioned something about 600 assuming credit score, right?
Yeah.
Yeah. So you still have to qualify for a home loan or qualify for a mortgage through a financial institution. The emails or messaging that you're getting, are you saying that's from VA or is that from private bank companies?
I think it's called United Home Loans or something like that. They work together with the VA.
Yeah, they say that, right? So
yeah,
a lot of these places will say that. Officially, VA does not work with
anybody. Yeah,
right. Officially, and a lot of those emails that you're going to get and the letters you're going to get, they're going to have something on there that makes it very hard for you to determine, is this from VA or is this from a different company? They love to do that. They love to say, put VA on there somewhere within the parameters of the law. But if they're sending, I can't speak to exactly what they know about you, but they purchased your contact information somehow. They somehow know you're a veteran. They somehow know you could be eligible for a home loan. And
I signed up. Excuse, not to interrupt. I signed up
sure.
years ago when I thought I was going to get my rating, and that fell through. So I was like, yeah. And it's been sitting there, and I guess all of a sudden now they know I got my rating. Boom, they're hitting me again.
Yeah. Yeah. So so if you have a rating though, you also do have a different source of income, and a source of income that you're able to prove, and you're able to go on the VA Home Loan or VA Health and Benefits Act or VA.gov. You're able to download that benefits letter saying how much you're getting from VA disability every month. So now that you have that, that definitely factors into your credit score because it's a source of income, not taxable, of course, but it's a source of income that you can rely on and use. So I think you are in a really good position compared to what you were, obviously, because you have your rating, but it may also help your credit situation in being able to find a bank that's willing to lend money to you on top of your disability rating, on top of the VA home loan guarantee that should secure the deal for you and make that accessible, hopefully, to help out you and your family, as you mentioned in the chat. Does that answer your question?
Yeah, it answers it very well. I appreciate your help, and thank you.
Yeah,
no problem. Go ahead, Tom.
If you look at the links on the other side, you can go there and get your certificate of eligibility, and that's pretty much what will start the process of you utilizing it, because you need that COE to utilize it.
And when I was in Florida, when I was living close to where Donnie lives, actually, and I was buying a house, VA made me do a lot of other inspections through the VA home loan that they didn't require, if I wasn't using the VA home loan, like special termite, special windage, special even accessibility, and I remember the realtor saying, "Man, nothing gets past the VA inspection," and they were kind of worried about it because the house was a little older, and I was so fortunate and blessed to have that done because they caught a bunch of things. So VA doesn't typically, as I see something in the chat, VA doesn't really let you buy something that's going to mess you up later on because they are guaranteeing it. And it's a really good program all the way through. And it's really fast in most cases, especially the underwriting and everything like that.
If you work,
yeah.
Sorry.
No, sorry, Donnie. Pickleman Ranger. I love these names. Put in the chat, I have 10% rating and did not have to pay the funding fee. So I think you might be right. It's 10%, not 30%, I think. But yeah, if you have a certain rating, you don't have to pay the funding fee. And then you should have a VA inspection on top of a regular inspection in most cases. But anything else you want to add, Donnie, or anyone else before we find another one?
I just wanted to add one more thing to that. With if you go through a lot of Navy Federal or USAA or one of those groups, they'll have individuals who are used to working with these loans who will actually kind of walk you through. They'll guide you through the whole process, and they'll take a lot of the pressure off of you for understanding how this works.
Oh, there's a question of something. Well, I don't think there's a question, but something you may be interested in. A lot of people ask, can I build a house with a VA home loan guarantee? The answer is yes, you can. If you're looking around right now, it's evidence. I built this house with a VA, and we built a house with the home loan. And you just have to find a lender who's used to doing that, and a company that's used to doing that. And it really wasn't. I have bought a house previously and sold a house, and then built this house all on the VA home loan, and it wasn't anything crazy compared to the first time around. So make sure you look into that. And there's a question: does Champ VA have dental coverage? Donnie, is that something you want to grab?
So dental coverage is so dental coverage is separate from Champ. Champ VA is for medical. Now you could maybe have some oral surgery stuff involved there, but as
VA would apply to your dependents, though, right?
Yeah, well, that as well, yes. So
then, I guess we're asking, does Champ VA have dental coverage for the dependents? And I just Googled that, and it says it does not cover dental care for your dependents, I suppose, including dentures, partial dentures, routine care, or another word I can't pronounce, care. However, say again?
Like periodontics or something?
Orthodontia? I'm a Marine. Come on. Leave me alone. Okay. However, Champ VA does cover dental treatments as part of the appropriate treatment as some other non-dental covered positions. So I'm assuming if there's something going on health-wise that's not specifically dental, but dental's impacting, they're still covering. So, but overall, sounds like no, you can't just go to a dentist if you're a dependent on a Champ VA program. If that answers your question. If not, American Woman.
Now
I don't think I sang that right, but
there is a MetLife program that the VA does sponsor that for dependents, for individuals on that. So that's something you could check out as well. Is just Google MetLife dependents, and the VA should have a program that may support that for you.
Donnie, you might be all over this question. My daughter is graduating high school this year. What other benefits does she get besides Chapter 35?
Well, Chapter 35. How old is she right now?
Hey, Glee, you want to put your hand up and we can have a conversation if you're willing to go on. Mike? His daughter is 17 while he's being elevated.
I didn't know if he's wanted to come up here or not.
Yeah, he's here.
Okay. All right. So with your daughter going into college and utilizing Chapter 35, she can still be considered a dependent, but once you start utilizing Chapter 35, you will lose your dependent. What's that called? Like when for your disability compensation, she will no longer be on that part of it, but she can still be accessed as long as she's going to college through Champ VA. Now you have to submit paperwork stipulating now if she turns 18 before college starts, you have to turn it in saying, hey, yes, she does plan on going to college. She's not in college yet. And then once you get the college paperwork, you got to get it certified by their enrollment at the college and send it in to verify college enrollment. But she can stay on Champ VA until she's 23. But yeah, Chapter 35, they can collect it at 18 if they're in high school still. It will not affect their overall time limit for using Chapter 35 for college. But once again, once you start turning that dependent over to Chapter 35, you lose that portion of your disability compensation. So they can live with you and everything, but once they start using Chapter 35, you lose that dependent status or the dependent income for that one dependent. And what state are you in too?
New York.
Okay, and you might want to look up, so like Florida, if you're 100% total and permanent, you also get what's called CSDDV, which is a state benefit for veterans who are 100% or excuse me, for dependents whose parents are 100% or deceased from wartime. Then they will get that CSDDV, which pays tuition as well as that. So I mean, that's something you might want to look into New York and see if there's something state benefit wise that'll coincide with that, and they can lump them together.
Okay. So you said she's turning 18 a month before she goes to college.
Okay.
So if I want to get that 1 month of disability extra pay for your kid.
Yeah. So all you have,
To
but
do
what
that
you have to do for that, yeah, you have to provide paperwork to disability stipulating yes, she does plan on going to college. She's still going to be living in the house, and I'm going to tell you, you need to get that paperwork going soon, because what's going to happen is there's going to be a back. Like right now, I have paperwork in for my stepdaughter who is going to college. Well, she turns 18 in like 2 weeks. So she'll stay on, but she has, for Champ VA reasons, she has some medical things that need to stay on. So it's been like 4 months now. So I don't know if when they're gonna, but it's gonna lap at one point or another. So I would suggest getting the paperwork in as soon as possible. So that way, if there's any lapse, you don't have to deal with it. You can just go ahead and go right through. But I would go ahead and submit the paperwork for dependents, planning to go to college, and then go ahead and start submitting the paperwork for the college portion.
We're talking about DEA, right?
The dependents.
Chapter 35, Dependents,
Yep.
Education, and Assistance. Okay.
Hello?
We can hear you.
Yeah, they just sent me that paperwork actually like a couple days ago. I have to fill that out.
Get on that now, because it'll take a little while.
Okay.
Yeah.
All right. I was just curious if there's other benefits. I think there's some state ones I have to look up.
Yeah, that's where you want to really look, because the states is where it really follows a lot of different stuff. But as far as federally, you're looking at the education and the Champ VA.
All right. Thank you.
Paperwork, otherwise they'll fall off Champ VA once they turn 18.
Thanks for your question, Glee. Hey, Donnie, how familiar are you with life insurance? The new life insurance program is pretty new to VA, and I think it's pretty tricky. So there's a question here. Will I lose my free VA life insurance, that 100% T&P, or P&T, I'm assuming, that if I get VGLI? Free life insurance, so you're talking about the 10K. Yeah, I don't think I can answer that question accurately, but we can look that up and put that back in the chat. I don't want to steer you wrong.
And what I can do too is I can follow up with them tomorrow or something as well. So I'll write down. If you Jumpmaster, if you want to send me like a little chat real quick, or is it Jumpmaster? Or is it who is it? Oh goodness, Cootie Shadow. Cootie Shadow. If you want to just send me a direct message real quick, and then I'll follow up with you tomorrow.
That's what I love about the Q&As and stuff we're doing on Discord. Is you can just follow up and send you a message later on. Compared to like in person, It's like you get 5 minutes, and if you got to follow up, what if you smudge the email address? What if the person, you got the wrong number, or the person had to run to work or something? Like, that's why it's so great to be here, y'all.
Or if they write like an angry third grader and you can't read their writing. Yes.
All like me, yeah. I don't see too many other questions. Anybody want to put their hand up or put something in the chat? Otherwise, we can just start talking about other stuff.
Go through it back.
If you, well, I'm not going to ask for you all to identify yourselves as, I'm assuming a lot of you are already using VA healthcare because you're already connected through the VFW. Okay, awesome, Jump Master. If I'm just going to tell you, VA healthcare is pretty awesome. If you haven't jumped into VA healthcare yet, there's a lot of, oh, it isn't? Well, if you wanted to give us your experience on it, you feel free to put it in the chat and we can talk about that and definitely see if we can resolve anything for you. But I've been at 6 different VA healthcare centers and I've had a lot of great experiences. I've had a lot of great just interactions and being able to talk to my provider whenever I want to. Community care I've used, and it's a really good healthcare system, and that's proven through data. It's a little harder to compare that to private sector because private sector doesn't put a lot of their data online. Thankfully, through Medicaid.gov, Medicare, Medicaid, we are able to compare quite a few things. And consistently, VA is doing very, very well compared to private sector. One of the things that you won't see is private sector doesn't really have to talk about their mishaps like VA does because we're accountable to the public. So you're going to always hear a little bit more of mishaps and negativity coming from VA because we are a public healthcare system and we don't have the same requirements or lack of requirements that private sector does. But I use VA healthcare. I'm a big fan of it. I recommend you use it. Talk to Donnie and I if you're having trouble getting in or have any issues. Even if there are personal issues, we're happy to work with you and take it through. Yeah, I've used Bay Pines, I've used Tampa, I've used Chicago, Erie, Pennsylvania, Pittsburgh, Washington, D.C., and Kernersville, Salisbury. Before I was even out of the military, I had a surgery at a Tripler VA and Army hospital in Oahu. And I've had a lot of really good experiences. So I recommend you try it. Not all VAs are the same. If you don't like one, you get up and try to go to a different one if you're close enough to one, like Tampa versus St. Peter, things like that. But otherwise, please let us know if you're having any issues. We really want to help you and resolve that.
Hey, don't criticize. What are you OEF, OIF, or what era are you?
I think we're asking Jump Master, right?
Well, I was looking at don't criticize. He says he uses Bay Pines, so I was trying to see if there was go for. Okay, well, I was going to say if you were the OEF, OIF era, they have, and this goes for anybody out there, actually, to tell you the truth. The OEF, OIF era has things called transition patient advocates that are within every facility, and they are there for that era to basically utilize and kind of navigate through the VA system. So if you ever want to look for one, the VA, again, the VA.gov, and I actually have to Google this every time because they change the name of the program every so often. But right now it's called the N to VA, Military to VA Transition Clinic. But they all have specialized transition patient advocates who literally will sit there and walk you through and guide you through things and make sure you're linked up where you need to be. So I was gonna pass don't criticize off to Mr. Rodriguez over in Bay Pines, but. Oh.
Yeah, I know Spokane does really well on a lot of their metrics. It's a nice place too. Anybody want to put their hand up or ask a question? EHR, I'm only a little familiar with EHR, electronic health record, but I do know that there's a lot of opportunity for EHR to really connect a lot of things. It's going to be great when DoD and VA record system are on the same platform. It's going to be really helpful, especially when you imagine all the places. If you're like me and I came into VA with like a big stack of papers from my military record, that's hopefully going to be a thing into the past from all those medical history, especially, and bringing that over to support claims and have a continuity of healthcare from one side to another. They're starting to roll EHR out at a couple places. I think you said Pet Rock. Yeah, so Spokane was one of the first places that they rolled it out. And when you roll things out at a place for the first time, there's always going to be hiccups. And I think there was a lot of hiccups at Spokane. And I would love to hear your experience using it if you wouldn't mind sharing. If you want to come on, and that's always really important for us to hear from the veteran perspective. But like I know it hasn't been easy with that. But it is pretty exciting as they start hampering out a lot of those kinks for VA across the board.
I invited Chauncey to talk, but I don't know.
There we go.
There we go.
Yeah, we can't hear you, but I know you're talking.
There it goes. Had to hit the headset microphone button.
Cool.
So, hey, retired less than a year ago. I filed my disability claim and got a letter back. I think there's an error in how they determined one of the conditions that I filed for is my best route to file a higher level review, or is there a different avenue or approach I should take?
You want to bring the VSO down there up in there?
I thought he was on here with the
VFW VSO is on the audience list.
let me
But Chauncey, what state do you live in?
I live in Florida,
Florida. Okay.
Where about?
Tallahassee
Oh.
area.
I can link you up with some people if you'd like on the backside to assist you with that if you want.
Okay.
yeah,
I'm in the Florida area.
Chauncey, feel free to DM the VFW DS or VSO that's on in the audience
Perfect.
too.
And I DM'd them earlier today, and they responded to one of my questions. Actually, it does look like they're asking me to send them an email too. I was just kind of looking for what strategy makes the most sense at that point to move forward.
Hey, Chauncey,
But appreciate it.
if you don't get the answer you need from that process, we do have an event coming up in 2 weeks called the Veteran Experience Action Center, specifically for transitioning service members who got out within the last year. And if you want to send Donnie or myself a message about that, and we'll get you an invite to that because it's exclusive for transitioning service members. They're going to virtually link you up and have one-on-one interaction with VBA and the right experts to resolve that, hopefully at the same time, if you can't resolve that through figuring out what evidence they need or what form you needed to send.
Perfect. Awesome. Thanks so much. Appreciate it.
Thank you. And welcome back. Glad you're out.
So Jumpmaster, why can't they talk to military MTFs? Was that just in regards to the electronic health records? Okay, so I deal with a lot of MTFs and everything with the M2VA program, so I didn't know if there was something more you wanted to elaborate on or anything.
So while he's typing that, actually, I was an RT, so I know the struggle. Yeah, maybe Donnie and I are missing the context for the military MTF, or what you want us to talk about on that. EHR. Yeah, I wouldn't be able to. Oh, okay. Sorry, man. It's hard with text. Rhetorical, got it.
Rhetorical, so that way we don't jump back on it.
Yeah. Appreciate it, dude. So all right. Yeah, I'd love to talk about PACT Act. PACT Act did a lot of things for veterans. It made you eligible for healthcare if you deployed. It made you, and I'm talking about Iraq and Afghanistan, Vietnam, for anybody who wasn't already eligible through their service in Vietnam. It was a great expansion of eligibility. And then a new thing happened after the initial PACT Act, which is PACT Act 103, which expanded to even more eligibility pockets of veterans. So even if a veteran had never deployed but was exposed to toxic exposure, they're now also eligible for healthcare. But if we switch gears to disability compensation, and I know Donnie could probably add in a lot there for specifics, but in general, if you were in Iraq or Afghanistan, even Syria, if you were in Vietnam, Cambodia, some of those other places around there, and you did a combat deployment, you're presumed exposed to toxins and you have toxic exposure. You're eligible for VA healthcare through that presumed exposure. Then on top of that, one of the first things you're going to do in VA healthcare is you're going to get a toxic exposure screening through your primary care physician and one of your first appointments. And I think you're going to have one every 5 years at least, if I believe that's the number, 5 years. But they're going to go up and down and make sure anything that's related, and they're going to link it up. Your burn pits, they're going to be making sure they're taking a closer look at your lungs, that type of thing. But when you talk about disability, that presumed exposure also applies. So we all talk about presumptions when it's VA disability and compensation disability. Well, there's a lot more presumptions. I believe there was over 300 presumed conditions that would be attributed to toxic exposure. So in general, I think we all talk a lot about, evidence and, I was over there, this is connected. Sometimes people say, well, VA didn't see the same way as we saw. PACT Act is a really good thing for a lot of us that was downrange and was exposed to, and I'm also talking about Vietnam, of course, as well, that was exposed to a lot of toxins because the presumption has shifted and been added to the veteran, opposed to the veteran has to prove that there was a service-related condition, if that makes sense. Donnie, you want to take it from there?
Well, I just wanted to add a few things. So if you're talking about also when it comes to disability stuff, and they did the presumptions, and there's a list of them, you can find them. There's other, so this kind of overlaps with what's called environmental health. Environmental health, which factors in like embedded fragments and factors in Agent Orange, burn pits, stuff like that. So the individuals that work on that are called, I'm going to spell it out. It's the WRIISC. It's the risk. And why it's important is because if you are battling with the VA saying, yes, I believe this is related to burn pits, I believe this is related to Agent Orange, you can request a consult from your primary care to be connected with the risk. And why that's significant is because they can actually pull you in. If you talk with them, they can go over what's going on with you, and then they can pull you in and do their own studies, and they could actually provide that stuff for you to help you get service connected and stuff like that, to help you find out if this is for sure something that was deemed from the burn pits. And what that also helps is other veterans down the road who may occur and have these issues cover up as well. You've already kind of done the legwork for them and going forward. So again, if you feel like something that's not listed on there, talk to your primary care. Say, hey, I'd like to talk to the risk. This is a WRIISC. If they don't know what that is, there's an environmental health coordinator and environmental health clinician at every hospital. Those should be points of contact that the hospital knows, and then they can also kind of talk the provider through it or do the request themselves.
Speaking to the Gulf War illness, PACT Act and the eligibility there and the conditions for eligibility really does, I think a lot of it, and I'm not an expert on toxin exposure, of course, but it does add a whole new layer of things that Gulf War illness and veterans that have been impacted by that. It does add, kind of takes a lot of those. So in general, maybe they're not specifically having to go through and get diagnosed with Gulf War illness anymore. Maybe their conditions are already covered by the other PACT Act eligibility. So it takes a lot of onus off of having to prove that condition just in general for what's covered under PACT Act. And how do you sign up for the PACT Act screenings and compensation? Okay, so with VA, we're talking about two things, VA healthcare and VA disability. So under PACT Act, you're eligible for healthcare from VA. You also have a whole lot more presumptions for VA disability based on your toxic exposure. So what you want to do is definitely get into VA healthcare. At the same time, you can work with a VFW, VSO, or a benefits expert, and to help submit your claim. You can go to va.gov and you can submit your claim yourself, but I don't recommend that to my friends. Make sure you go through somebody who knows what they're doing and can help you on that. But so that's two things. You can go through VA healthcare and submit for a VA disability or compensation disability rating at the same time. Does that answer your question, Whiskey Gunner? I've seen Whiskey Gunner before. Right? I think you're in Regiment 2, aren't you?
We can check on that real quick.
Yeah, right on. So that does answer your question, though, not just I know you're in Regiment. So if you go to va.gov, you're going to be able to find your local facility. And when I first got into VA, I didn't want to. I just went to the hospital and walked in the front door, and I said, "I want to use VA," and then they showed me what to do. Right? That was the easiest thing for me. So I would recommend, if you got some time off of work or whatever, just walk into VA and get signed up, and hopefully in some cases they'll probably be able to set you up with a appointment same day if it's like the hospital that I went to in Erie, Pennsylvania. Shout out to Erie.
But if you want, I can if you have a if you let me know where you're at, I can actually get you a point of contact to link you up with an individual that can assist you with everything as far as going through that and trying to get everything associated with your if you want to do the environmental health screening or whatnot. I'll get you a point of contact.
And then once you're in VA healthcare, they're going to give you a toxic exposure screening. Some of that information may be relevant for your disability rating later on. It'll be connected. Will they be changing the ratings for certain conditions such as sleep apnea, tinnitus? I'm not sure if that's related to what's been discussed. Yeah, that's more, that's like legal jargon, and that's probably, I don't know, Donnie, that's not something we can really
Well, I mean,
comment
they
too much on.
review. They had that pass and review last year, or review, and what is it called? I think it's called wherever, where people could review the top because they were thinking about doing things, and then that went through like public review, and so there was a big concern about that. So, but yeah, that's about all. There was nothing that followed through with it, but yeah, it's like Tim's saying, that's something that kind of exists in its own kind of area, but nothing came to fruition of it so far.
Okay, so Whiskey Gunner, if you're already, it's just cool to say Whiskey Gunner. I mean, those are just two cool words. But Whiskey Gunner, what you got to do next time you go to VA for your primary care physician, you got to make sure that maybe they gave you, maybe one of the times you were there, I've heard of veterans being asked questions and didn't realize they went through a toxic exposure screening, and the care provider knew them enough and just kind of started filling stuff out and asking them questions that they didn't know from it. So just make sure when you're there, you ask them, hey, I really want to make sure I have my toxic exposure screening, and they have a form and they're going to go through all the questions. But again, if you've been seeing your healthcare often, they know a lot of those questions for you and can answer a lot of them on behalf, especially if, again, they know you pretty well and you're there often. So I'm actually fortunate now where I've seen my primary care physician enough where she remembers me and it's pretty cool having that relationship. But yeah, thanks for being here as well. Don't criticize. And the VFW VSO said it's still being reviewed in the Federal Register, and that's to the apnea tinnitus. So yeah. We're still going to be here for at least 15 more minutes if y'all want, if there's any more questions or anything. And I don't think this is the last time we'll be here either. So we're definitely, really appreciate the invite, VFW and Lynn, for having us. I know we're happy to come back. If you guys have someone who quarterly, I was thinking more than that, but quarterly is fine too.
Sorry.
Say again, Donnie?
I talked to Lynn about right now starting to do alternating weeks leapfrogging, but there will come there's a big thing planned with Regiment right now that will kind of conflict that to make it kind of leapfrog back and forth. But I don't know if Tim wants to speak on that as well. What's in the proposed stages, or you want to speak on that later?
I don't know what you're talking about, Donnie.
Okay.
Say again.
I don't know if I was supposed to take a hint there. I was gonna.
Oh, I don't know what you're talking about.
I'm talking about Ryan.
Yeah. Okay. Cool. So, I mean, Donnie, you share those details and invite all the guys and girls.
All right. Well, so on May 9th on Regiment's server, which Regiment is another gaming community server, we will be hosting a Q&A session with Ryan Pitts, who's a Medal of Honor recipient. So we're pushing that out there. If anybody's interested, please let us know or let Regiment know. So it's going to be a live Q&A with myself, Tim, and Mr. Pitts. Or Pitts.
I'll tell you a funny story. So 10 years ago, I used to live in DC, and I was invited to go from VA to do some media stuff from VA for the Ryan Pitts Medal of Honor recipient, right, when he was receiving his award from President Obama. And the day before that, there's a media roundtable with him at the Pentagon, and I was invited to go to that. So I went to that, and reporters are asking Ryan deep questions, and you all know what it's like here, or at least I've seen how that goes. They're asking Ryan basically about the worst day in his life, and you could tell, like, just answering the same questions over and over. And I might tell this story again, whenever in the next week, right? But at some point, and these are seasoned journalists from Washington Post or Washington, those kind of things. And I'm the low man on the totem pole, and I ask, "What's your favorite MRE?" And him and some of his friends who were there just did not expect to get asked, "What's your favorite MRE?" It's such a serious, solemn thing. But it was Vegetable Mancotti, and I talked to him again on email the other day, and it's still Vegetable Mancotti. But we're excited to have Ryan, and Ryan does use VA healthcare. He does a lot of really things that he would recommend to others, but also it's a really cool place for people to ask him questions. So we hope you can join us on that. Did we miss any other questions while I went on my tangent?
They're asking if
when you move.
Well, I just want to
go ahead.
Say Regiment is Legion. The Regiment's their own business, correct? They're not affiliated with.
I don't think Regiment's Legion. I think it's regiment.gg. But we got a Whiskey Gunners on Regiment. You can set us straight.
And I'll discuss that. We are working with Regiment as a fellow veteran community. Legion does handle a lot of their VSO type of things, so there's no bad blood. No, it's a great opportunity to meet Ryan Pitts and interact with the VA once again. So all good if you want to jump in.
Yeah, no, I think we're all really excited. Everybody's working together on this, and we find a home. It's great as long as you find a home.
We're building a community here.
Absolutely.
Yeah, when American Woman said, "When you move to a new place, can you reschedule outstanding community care?" So if you still have 10 different visits for your chiropractor or something, can you reschedule? I don't think so without going back. I don't think you can without, when you go to a new place, something, and I did this when I floated back and forth between Washington, D.C. and Tampa, you have to go to the eligibility office of the new facility you're going to, and they need to physically transfer you into their catchment area and under their umbrella, healthcare umbrella of sorts, and then you're able to be scheduled out. So I think, I don't know if they're going to be able to use the existing referral or not for their network, but you definitely have to talk to the hospital when you switch, so they get you on their system, if that makes sense, American woman.
How far up was that?
It was up there. I'm going back. I'm at like Sasquatch or Squatch over here. Is there a way to ask an offline question with a diagnosis procedure I had done recently? Yeah, I would say Donnie's the guy to ask for that. So send him a message, and even when we're off of this, Donnie or I will be, mostly Donnie though, will be floating on this channel and looking at some of your the chat room for if you have a VA question chat room or the general chat room or everything like that, trying to be available as possible. I get it now. You're talking about Legion as an American Legion. I missed that. Is there a gaming perspective presence at the national headquarters of the VFW in Kansas City? Lynn, you wanna ask this question or respond to this question? Is there a gaming perspective presence at the national headquarters of the VFW in KC?
Yeah, I thought I responded. I'm actually the VFW National Programs Director and handle all the new programs, new initiatives. That's a great question. Yeah, believe it or not, we're not all old. Hey, I'm gonna take the opportunity, guys, and I'm gonna go ahead and throw in the survey. If everyone on here can take the opportunity to fill out the survey, that way we can learn from this chat. Provide any feedback. There's a couple questions. I'll go ahead and drop that in there now. Please fill. It'll only take a quick second.
And that helps us greatly, like especially right now. Like I said, this program's being piloted underneath Tim's guidance. I'm working through it, trying to assist him to build this. And with this questionnaire, it helps us be able to make analytics and be like, hey, listen, this is the group that we're reaching out to. This is their needs and everything else. So we can go back and say, hey, listen, this is working. This is doing. We're reaching this population. We're finding their needs. We're reaching people who normally would not be able to be reached. And not only that, we're putting a new face on the VA. I don't think many people would expect the VA to be popping into game servers, being able to talk to the veterans directly. So please help.
Yeah. We're here if you need us, and thank you for filling that survey out. It just helps us understand where to put resources, and this is important. Thanks, Lynn.
No problem. That only takes a couple minutes.
If you know how to read.
Yeah, true.
I'm still learning. Hey, we probably got time for one more question or two more questions. If anybody has one, they're willing to voice.
Fire away.
I'll put out a PSA here. So if you all are married or have significant others, make sure they know where your DD-214 is. Make sure they know where some of your veteran benefits forms and things are. Like I said at the top, I am a post commander, And some of our I've been through a couple funerals and a couple deaths of our own members. And that's just something you don't want your significant other to go through, trying to find paperwork at the worst time of their life when they're grieving their veterans. So just make sure that your significant others and if you're married and even your children, make sure they know where your folder is and stuff. Get that black folder updated. Exactly, Pet Rock. It's really heartbreaking when you're trying to find that DD-214, and if you're a member of your VFW does not keep your DD-214 on file unless you're an elected position in the VFW post, right? So that's not an alley you can go to. So again, just try to think ahead. There are resources online. VA does have some resources. We could pop that in the chat too here to help think about wills and things like that. But just got to think about your family when you're gone and how to make it easy on them. So a black folder, as Pet Rock mentioned, is really like what to do. The joke is when I die, erase my internet history, right? So when I die, erase my internet history, but also know where my black folder is, which has all my information in it, like my DD-214, so I can get a veteran benefit burial type of thing, making all that really easy. And any other important paperwork, like logins to bank accounts and things like that, if you're the one that takes care of all of that. So, does a veteran lose financial benefits if they were to go to inpatient care? Not inpatient care. In fact, if you're going, and Donnie, I'm going to be the expert here, but I do know I have some friends who went to inpatient care and their benefits, their disability compensation increased during their time in inpatient because they were fully hospitalized and could, met that condition. I think where you start talking about losing benefits, it's not necessarily losing it. If you're going to go to certain assistant care facilities, they may, correct me if I'm wrong, Donnie, but you could go to like a assistant care facility and they may take your VA disability compensation benefits, but provide you full round-the-clock care like that. But over to you, Donnie.
So I was going to say, so we was talking about the first time. So if you get care at the VA to where you are an inpatient and you're 70%, say, and you get a surgery done, what they'll do is they'll pay you I think it's called convalescence, to where they'll pay you that 100% rating while you're going through your basically like your therapy or your recovery stages, and that amount of time usually it can go up to 3 months. After 3 months, it has to be renewed by the provider. So the provider has to make the stipulation of how long the recovery session is. Basically, it could be 30, 60, 90 days, and you'll get paid that 100% while on that time. And as far as what Tim was saying elsewhere, yeah, so there's if you usually use the inpatient care, there can be times where they can deduct that from your in order to pay for the care, they'll deduct it from things. Yeah, and the only time you really if you are incarcerated, I think it's for over 90 days, then you lose you'll be dropped down like 10%. And if you're at 10%, then you lose that I think they drop, it's either $1 or they drop it to nothing. But if you're incarcerated for over 90 days, then you'll lose your compensation. And then when you get out of incarceration, you'll have to get it back.
I have a good friend who knows if I kick the bucket, my wife knows to talk to that friend, and that friend knows to reach out to my wife to take care of all those things. So recommend you get yourself a battle buddy as well.
All right, we're gonna wrap this up. Yeah, some great comments coming through right now. We're going to wrap this up. Please fill out that survey. And thanks, Donnie and Tim.
Thanks
And
for having us.
we're definitely going to plan to do this again. We'll look at them. Donnie and I've got putting together a plan right now to keep this going. And I like some of the comments of, potentially right before the season starts. So feel free
Lynn,
to go ahead.
if you all again open, we're happy to be here and answer questions. But if you all have a specific topic that you all decide is, hey, we want an expert here on home loans. Donnie and Tim were great, but they didn't really know what the heck they were talking about. Can you send somebody who knows what they're talking about? I want to know somebody who knows the law on this or that. Just tell us what it is: home loans or Champ VA or dental, or you want a doctor here? We'll bring a VA doctor here. Like, you tell us who you want here. We'll bring them here. We'll set them up, and you can put them down.
For sure. Yeah. So everyone, if you got comments or want a specific, either post in the actual server or hit me up personally, and we'll get a specific topic done. Especially if you got one that you post in the survey. So down to play. Yeah, and feel free to link up with each other tonight and play some games.
Yep.
So with that, thank you all. Yeah, hey, Jump Master, they just like us. They're vets too. All right, everyone, have a great night. Be safe. We'll sign out.